Hello everyone, this is Chadi Alraies from SCAI 2022 with me, Dr. Bala Pushparaji. He's going to talk to us about cardio-oncology, which is an unusual topic at SCAI, but it's very important science presented.
So a little bit of a background, cardio-oncology, as we just discussed, it's a great intersection between oncology and cardiology, which are still the top causes of mortality, right? So with cancer, really, becoming like a chronic disease, survivorship has increased a lot. So cancer and cardiology and cardiac diseases have now skyrocketed in cancer survivors. And also they're part of, they come as a side effect of the cancer treatment itself. So now, historically, most of the cardiac trials, they exclude cancer patients because they are considered as sick patients, right? And when it comes to PCIs, any interventions of that matter, even coronary, structural heart disease, the partner trials recently that came about, they don't include cancer patients, the partner 1, 2, 3. So no one really knows how TAVR outcomes are. So the goal of our study really is to include this underrepresented population in a study and hopefully get relevant data for our general cardiology attendings, to use them in their practice, right? So that forms really the basis of our study, right? So our group at MD Anderson, I'm very proud to say that we are pioneering in the field of cardio-oncology and basically, bringing about expert opinions on this. Unfortunately, we still don't have trials, yeah, of course, you're absolutely right. So that is where machine learning really comes into place. So the study, what we have done is we have looked at the national inpatient sample, which is really a huge database at that. Our previous studies included, patients up to 2016. We have done studies on structural heart disease, TAVRs, and then PCIs. And we found that, mortality was not really high in cancer patients in spite of, undergoing a PCI.
Regardless of the cancer, solid or liquid?
Solid or liquid. Of course, you're right, Chris, in pointing out sometimes leukemias and lymphomas probably have a little bit of a higher mortality when it's compared to solid cancers. As you know, not all cancers are made equal, right? So that said, the overall mortality was not significantly different. Interestingly, we also found the length of stay and the cost for the patient was drastically lowered when people actually underwent these interventions because they are considered life-saving, even if they are cancer patients. So now coming on to our study in specific, we looked at thrombocytopenia in cancer patients and whether a PCI would cause increased mortality. Very specific.
Because if you have low platelets,
yes,
antiplatelet therapy post-PCI,
exactly,
it's the first question.
Exactly. So now, do these people should be on DAPT therapy? So no one knows. We don't have, great results on these studies. So our study basically looks at thrombocytopenia and, people underwent PCI as opposed to cancer. And we generally found out that there's really no mortality benefit. As in, there's no mortality, significant mortality with, low thrombocytopenia. And, there's actually an increased benefit by undergoing PCI. And thrombocytopenia. Less risk of MIs as well. Let's say you have a cancer patient who actually has thrombocytopenia because of the cancer treatment or per se because of the cancer itself. And if they don't undergo PCI, or elective or emergent, the risk of MI in the first 6 months of their cancer diagnosis is quite high. So that is why we think PCI in the realm of thrombocytopenia and cancer is very important.
So what you were I just reflect on this point is you're saying you shouldn't deprive these patients from a PCI if it is indicated and needed.
Of course. So that is what you're trying to say, that these people are underrepresented, PCI is underutilized in these people, and cardiologists are generally scared and their fear is well founded. But our goal is basically to remove these fears.
And do you think you focus on PCI? You didn't include any structural heart. Do you think that will be coming as well?
So, like I just mentioned a little earlier, this particular study is on just PCIs. Structural heart disease is still a little out there. We had a similar paper, but it's not very recent. It was done in 2016, 2018 samples, NIS, and we found that when we compared TAVRs, SAVRs, and medical management for severe aortic stenosis, there was no difference in terms of mortality. But we did find out that the cost of, again, like I mentioned, the cost of length of stay and cost for the patient much improved with TAVRs. Yeah.